Hello, my name is Rachel Lytle, and I am a nurse at finishing my bachelor's degree at Florida State College of Jacksonville. And I'm going to talk to you today about nursing retention issues and strategies. I apologize if you're having a hard time seeing, but I will speak to the slides. Before discussing nursing retention, I thought it would be important to begin with the shortage of nurse staffing, and then getting into kind of what's happening next with causes of nursing turnover. It has been estimated that in 2006 there was a shortage of at least 10,000 nurses. By year 2010, the shortage had grown to anywhere between 10,000 to 40,000 untrained, or a shortage of almost 40,000 trained nurses. It is said when nursing shortage is up, patients' needs do not decrease. Let's look at some reasons why we're seeing rapid nursing retention issues. Um, Big causes of turnover are stressful work environments, poor pay and compensation, the quality of care is a concern, workplace bullying was another one, and then burnout and poor work conditions. So, um, I'll speak a little bit more to those things. Um, so, environment and pay. Nursing work is stressful. Changes in healthcare systems have resulted in high patient acuity combined with shorter patient stays. So, combining the sicker patients with a lower length of stay and trying to rapidly get things out, really the requirements on the nurses have been way more, and that increased to the stressful work environment. Factors combined with with increased stressful work, nursing work environments, just like I said. Um, it says I want to talk a little bit more on the topic of pay. The average hourly hospital hourly nursing wage in 2003 was about $24, and it increased by 10% in the following years. But as U.S. systems and healthcare delivery were negatively influenced, the work environment, you started to see a decrease in the amount of pay that nurses were receiving. So pay is an issue for nursing turnover, but it's also an issue for nursing retention as well. Of course, quality is a big concern for why nurses are leaving a facility. Um, Much of the concern surrounding hospital nursing staffing is related to research, which links nursing staffing levels to both adequate customer or inadequate customer service to patients. So, staffing at minimum levels decreases the quality of the nursing work environment combined to nursing turnover. Another reason why you had poor nursing retention in a facility was workplace bullying. Bullying has been linked to negative work outcomes in a variety of occupational groups, but especially nursing. I know we used to hear the word nurses eat their young, and unfortunately that's still an issue. But nurses classified as bullied had significantly higher levels of burnout, lower job satisfaction, and poor psychological well-being than non-bullied nurses. So you combine poor pay, the work environment, stressful, um, and then you're delivering not good quality maybe because of high retention and vacancy. Now you're being bullied, so that doesn't make it any better. Um, and then to talk about burnout, burnout really consists of three components: emotional exhaustion, um, um, personal efficiency, and it's cynicism. And then the biggest core of burnout was that the emotional exhaustion really that caused a lot of the retention issues. And then, of course, it says job dissatisfaction, when present, has been linked to negative organizational outcomes, including poor working relationships, high turnover. The findings suggest that paying attention to working conditions that promote job satisfaction is an important strategy. And we'll also read a little bit more about that when we talk about the magnet status or strategies in keeping nurses or retention. So, what happens when there's a high nursing turnover? Well, of course, the biggest thing is quality. So it says in 2015, for every 10% of nursing reported job dissatisfaction, it says that the recommendation for that hospital dropped by 2%. So that just means that job dissatisfaction or that environment of that nurse is working in also affects the patient and how happy they are with their stay. You know that when you're sick and when you are in a situation that maybe is unexpected, the last thing you want is poor quality. You want the nurse that's working with you, you want to be able to trust her, you want to feel a relationship with her, you want to feel that she understands you. But if she's preoccupied with other things, it's going to be very, very, very difficult to get some good satisfaction. So quality is a big thing. And also, it could be a miss. It could be the patient didn't get turned every 2 hours. It could be increased risk of bed sores. It could be, she's just not attentive the way she should be. There's a lot of factors that talk about quality and care. So the implications are less time devoted with your patient, complications with infection rates, errors with medications. That was huge. A general length of patient stay is adversely affected by the high effects of turnover. And then we can look at cost. Cost is always a big factor with turnover. That's not in nursing, but that's everywhere. So loss of productivity, lack of staffing while positions are being filled. So people are trying to just kind of compensate to keep staffing appropriate. You always hear the words, "Oh, I'm sorry, we're short-staffed." Not very good, but it also affects costs because you train that nurse, you spent time, you really applied resources to him or her, and now they're leaving. And of course, and then the separation, the recruitment, and the cost of doing that, just like I said. So, and again, I apologize, it's a little difficult to see. So again, I'll speak to that. So earlier in the presentation, I talked about what you would do or effective strategies to nursing retention. So a lot of hospitals or a lot of organizations are adopting what you want to call a magnet concept, meaning they are more looking to get towards more of a magnet status. So they are trying to reach that level. From what I understand about magnet status, it is a difficult thing to achieve, but a very high standard. And we'll talk about, what's in for the nurse and why do we want to reach those concepts. But also, it is a culture of an organization. So, effective strategies to nursing retention is magnet concepts that improve quality of nursing leadership, that improve organization structure, that improves personal policies and programs, professional methods of care, that improves quality of care by identifying evidence-based improved methods. It improves employee autonomy, and it also improves interdisciplinary relationships and promotes professional development. So it's huge. And that really speaks to the causes of turnover. So stressful work environments, poor pay and compensation. And actually, magnet doesn't really speak to pay, but I can see where that would probably be addressed within your organization. The quality of care, workplace bullying. You'll see less of that with improved interdisciplinary relationships. You'll have less burnout because of the culture and the environment that you're working in. And the environment and poor working conditions. So you'll see less of that as you adopt more of a magnet concept. So let's talk about why magnet. So when I did my research, it didn't really say Um, it didn't give me a lot around, okay, what could we do to do, what one thing could we do to maintain nursing retention. They really spoke to the magnet concept, because magnet concept has several different core pieces that will help make your organization better as a whole. Now, magnet is more nursing, but really just understanding that it's not just one thing. All right, so magnet status. Oh, let me make sure I did that right. Yes. So if you're not magnet status and you're working to get that, how can you establish that culture? Really look at the concepts of magnet. But what is magnet? Why are we talking magnet? So magnet is a gold standard for nursing excellence. The focus is to create a culture that is the best practice or patient outcomes for the best work environment. So your patients do well, the work environment's good. Of course, those concepts like I talked about really develop a gold standard culture, which will help decrease your nursing turnover. Magnet is designed. Magnet designation means that a magnet culture has been created within the organization that encourages the nurse to flourish as a professional focused on professional autonomy, decision making that provides professional education, promotes leadership. Magnet recognition means that a collaborative work relationships are fostered. Okay, so research shows that magnet hospitals consistently provide high quality of care, the standard that magnet hospitals must attain through the program's recognition. So you do it every 4 years. You go, you apply or you redefend your magnet every 4 years, and it is really an honor to have, but it also increases the retention, increases rates of job satisfaction because of the culture of change, the culture of magnet. So what's in it for the nurse? Which is over here. Like I said, it creates the focus of a culture of improved patient outcomes, professional growth and development, education opportunities. Okay, so if we go back a few slides, it talked about reasons all healthcare workers are leaving. Okay, actually I could go back to that maybe. Yes, right here. So it talked about reasons healthcare professionals are leaving, and I'll go back to the magnet. Why is it in for nurses? But 13% were job opportunities. The 13% were immediate supervisors. There was staffing workload. 12% was why people were leaving. 5% work environment. 2% job satisfaction. 4% policies and procedures. And then 10% hours and scheduling. And I don't know if magnet would change with hours and scheduling, but that would be a reason for why. Let's see if we can get back to that magnet page. All right. So again, what's it in it for the nurses? You can see reasons why people are leaving the hospitals, and we're just speaking hospitals. A magnet doesn't just have to be a hospital. So high job satisfaction, low turnover and vacancy, focuses on professional autonomy, professional growth opportunities, and leadership opportunities as well. Let's see. Opportunities to practice professional nursing and a shortage, nursing strong interdisciplinary work environment. So that culture is promoting more teamwork, okay? And a culture that supports nurses to be the best they can be. So that's fantastic. If your organization is not magnet, develop the concepts. Really try to create that culture of change within your organization as you are working to attain your magnet status. That is how you will keep your nurses. Other than that, I appreciate you listening. I appreciate you taking the time to watch my video, but really also to try to understand how you can make your organization better. Thank you for your time.